Hey, this is Dr. Mike Simber with OD Coder, and today we're going to talk about ERG, which is procedure codes 92273, that's full field ERG, and 92274, which is multifocal ERG. So we're going to talk first about some of the conditions that we use very often to allow ERG to help us manage, and things like diabetic retinopathy. That's a really good example. But then we're going to tackle the issue of glaucoma. Can you be using ERG in the management of glaucoma? So let's start off with diabetic retinopathy. So I'm using full field ERG in the management of diabetic retinopathy. So if you meet the criteria of mild non-proliferative, moderate non-proliferative, or severe non-proliferative, then you can bill the 92273. This test reimburses about $118 in central Pennsylvania. The 92274 reimburses about $93 in central Pennsylvania. We need a written order and report, as with all of these procedures. And so you have to have medical justification for ordering it, and then you need a report, a medical report. So as I mentioned, any diabetic retinopathy code can be used. Changes in retinal vascular appearance, H35.011, retinal ischemia, all of these codes. Now there are other diagnosis codes that it's very helpful in. Things like branch retinal vein occlusions, central retinal vein occlusions, artery occlusions, any type of retinal ischemia. Any of these procedure codes, ERG is really helpful in. So the question often comes up is, well, what about in the management of glaucoma? Can ERG be used in the management of glaucoma? Well, Medicare guidelines specifically state that ERG can be used to diagnose the loss of retinal function or distinguish between retinal lesions and optic nerve lesions. So if you are trying to distinguish between retinal lesions and optic nerve lesions, ganglion cell complex lesions, then ERG is considered an appropriate use of that. If you use mild glaucoma, moderate glaucoma, severe glaucoma, those will be rejected. Now you can use codes like glaucomatous optic atrophy, H47.233. Now again, going back to using ERG as a way of distinguishing between retinal lesions and optic nerve lesions. So I know that was a lot of information, but ERG can be somewhat complicated in terms of billing and coding, but I hope that gives you a better understanding of the usage of ERG in the management of diabetic retinopathy and other conditions. Thank you for watching this video and all of the others, and we look forward to putting more content out for you.